The high yield topic for MRCP is tuberculosis treatment and their adverse effects. Always remember HRZ, HERZ, we known as HERZ. You can also remember it by RIPE, okay, RIPE, rifampicin, isoniazid, pyrazinamide, and ethambutol. Always remember that whenever we are giving the isoniazid, we must give pyridoxine, which is B6, because isoniazid has a side effect of peripheral neuropathy. Okay, always remember HR. Okay, HR is to be given for 2 months. Alright, HRZE is to be given for 2 months, and the HR will also be continue for the 4 months. So let me tell you that the HR will be given for the 6 months. Okay, H and R, isoniazid and rifampicin, will be given for the 6 months total, and only Z and E are for the 2 months. So in the first 2 months all of them will be given, and for the next 4 months only isoniazid and rifampicin will continue. Okay, so the adverse effects are for rifampicin: red, orange tear or urine or tears. It will cause hepatotoxicity and it is an enzyme inducer. Alright, and next is isoniazid. I have told you that isoniazid causes the, remember, I, N and H, okay, peripheral neuropathy and hepatitis, and prevent with pyridoxine. We can prevent it by this: pyrazinamide, gout, hyperuricemia and hepatotoxicity, and ethambutol. Remember, you can remember E from eye. Okay, it can cause eye symptoms, so optic neuritis and red-green color blindness and visual acuity. Okay, so here is an important buzzwords and the key adverse effect. Rifampicin, R for red secretions and enzyme inducer, INH neuropathy and hepatitis, pyrazinamide gout, ethambutol optic neuritis. So it can't see colors. Buzzword: give B6, increase uric acid, red plus interactions. Okay, high exam yield, always give B6 with isoniazid. Rifampicin causes drug interactions and it is CYP inducers, as you can see, R inducer. Okay, rifampicin. Visual loss, stop ethambutol immediately. Most hepatotoxic, PIR. Okay, PIR. Pyrazinamide, isoniazid and rifampicin. So next is the super quick recall: red, injury, purines and eyes. You can see that R for rifampicin. Rifampicin makes the urine red. I for isoniazid, peripheral neuropathy. Neuropathy is for nerve injury. Here pyrazinamide. Pyrazinamide is for purines because purine causes the gout. And E for ethambutol, and ethambutol causes the blindness, optic red-green color blindness and optic neuritis. Okay, let me tell you one to two more important things in this. Okay, so here is it. Whenever there is a latent tuberculosis, we will give isoniazid with rifampicin, okay, or 6 months of isoniazid. Right, I understand what I'm saying. Always remember that pyridoxine will be given with isoniazid. So for cramming stuff, remember it that 3 months of IR or 6 months of I. Okay, 6 months of I or 3 months of I and R. That if you need to treat it with for 3 months, then you have to put on 2 things, and if you need to treat it for 6 months, then you have to use the one thing. Like, 1 will take more, 2 will take less. All right, and that's it. There was another thing, that patients with meningeal tuberculosis, that was the latent tuberculosis, and meningeal tuberculosis for prolonged period, at least 12 months, with the addition of steroids. All right, and I don't think is there anything else which is left? Okay, one thing is left, that isoniazid also causes agranulocytosis, and it is also a liver enzyme inhibitor. Remember that rifampicin was an potent liver enzyme inducer. Okay, and I for isoniazid and I for inhibitor. Again, let me recap it. rifampicin, a liver enzyme inducer. Hepatitis, urine secretions, flu-like symptoms, and isoniazid is peripheral neuropathy, prevent with pyridoxine, vitamin B6. Hepatitis, I for liver enzyme inhibitor, agranulocytosis, pyrazinamide. Hyperuricemia causing that, of course, the purines. Arthralgia, myalgia, hepatitis, and ethambutol, which is optic neuritis and red-green color blindness. Plus, we have to check visual acuity before and during treatment.